Hello and welcome. I would like to start by thanking you for considering us for your procedure. The purpose of this video is to inform you about tummy tuck, also known as abdominoplasty. What is a tummy tuck? It is the removal of abdominal excess skin and fat in addition to the tightening of the six-pack muscle. Who is a good candidate for the procedure? Patients with abdominal laxity after pregnancy or weight loss, patients who want to remove the stretch marks, and patients who want to rejuvenate their body. What is a tummy tuck not meant to do? Removing excess skin from the back. Despite the fact that we're going to do liposuction to the flanks, the skin in the back may remain lax. Some relevant history in preparation of your procedure are number of pregnancies, abdominal surgery, hernias, respiratory history such as asthma, sleep apnea, and smoking, gastrointestinal history including inflammatory bowel syndrome and constipation, and finally, weight loss and gain. Stretch marks are the thinning or absence of the dermis. This surgery will remove the skin below the top of the belly button. If you have stretch marks above this area, they will be moved inferiorly. In rare occasions, the remaining stretch marks may become redder. Now let's learn about Brazilian butt lift, also known as BBL. The first concept that we need to understand is the ideal shape of the gluteal area has the letter A shape, as shown here. The usual gluteal shape has the C shape, as shown here. Some of the surgical principles about Brazilian butt lift is that it's not just about injecting fat in the gluteal area. We start by shaping the surrounding areas and removing the fat. Once this is done, then we inject the fat in the gluteal areas to have a more pleasing shape. These are some important numbers when considering doing a BBL with your tummy tuck. The maximum fat removal is only 3 liters. Usually we do it only from the back, less if the procedure is bloody. The fat survival of the fat that we inject in the gluteal area is only 50 to 70%, which means that you're going to lose some volume after you recover. Finally, the number of transfers in the hollow areas can be up to 2 or 3 times after the procedure, in order to get the heart shape that everybody wants. Now let's review some important considerations in preparation for your surgery. In preparation for your surgery, your health should be as good as it could be. Make it stable, especially if you have hypertension, diabetes, or anemia. When it comes to the labs, I will require that your hemoglobin should be greater than 12. Finally, ideally your weight should be stable or close to ideal. One of the most important topics in preparation for your surgery is to stop smoking. Please do not smoke 4 weeks prior to your surgery and 4 weeks after your surgery. This includes cigarettes, marijuana, and hookah. Also, please stop any blood thinners. This may increase bleeding during your surgery. Smoking has been demonstrated to increase complications with this procedure. Please do not smoke. In preparation for your surgery, I will encourage you to get closer to the ideal body weight. The thicker the skin, the less skin I will be able to remove. During surgery, I can remove between 1 to 8 pounds. This is obviously not a weight loss surgery. You cannot expect a body of 20 or 30 pounds lighter with this surgery. On the same token, losing more than 15 to 20 pounds after surgery will result in flabby skin in the future. For out-of-town patients, we'll ask them to arrive 2 to 3 days prior to your surgery. They should stay 5 to 7 days after the procedure. will require a medical clearance. Let's describe now the ideal patient's journey. My best results have been in patients that are committed to their own change. This patient was 31 when she decided to control her weight. Here you can see her starting to lose her weight after gastric bypass and exercising 6 days a week. 1 year later, she comes to me after losing 133 pounds. I appreciate the significant deflation of the tissues. On the right, she's 1 year after her abdominoplasty. The components for a successful story are determination, perseverance, positive attitude, and a weight loss team. In this order, you can radically transform in unbelievable ways. Now let's discuss the different types of tummy tuck techniques that we can perform. The first type is the mini abdominoplasty. Indications for this procedure is the removal of the excess skin and fat in the infraumbilical area, as shown here. This will include undermining of the area shown in yellow. The incisions will be 12 to 16 centimeters approximately. In the majority of the cases, we'll combine it with liposuction of the upper abdomen. The umbilicus won't be detached from this original position. However, it might migrate inferiorly due to the pull of the tissues. The most common technique in my practice is the extended abdominoplasty. Indications for this procedure are the removal of excess skin and fat in the upper and lower abdomen. This procedure is also ideal when we need to address the laxity of the abdominal muscles. The incision may be 25 to 35 inches long, depending on how long is the roll of the lower abdomen. In the majority of cases, we will combine it with some liposuction of the flanks, also known as love handles. The belly button will be cut and kept in place. This diagram demonstrates in blue the skin that is removed with extended abdominoplasty. The yellow area represents the skin that is lifted or undermined. The final incision lies down in a smile shape, as shown here. Now let's discuss a very powerful technique for patients that have excess skin after massive weight loss. It is called the fleur-de-lis abdominoplasty, also known as inverted T tummy tuck. This procedure not only addresses the excess skin of the upper and lower abdomen, but the redundant skin of the upper lateral area, as shown here. It also addresses the laxity of the abdominal muscles. This diagram demonstrates in blue the skin that is removed with the extended abdominoplasty. The yellow area represents the skin that is lifted or undermined. The final incision will look like an inverted T shape, shown here. A reverse abdominoplasty is reserved for patients complaining of excess skin on the upper portion of the abdomen that have undergone a tummy tuck. This diagram demonstrates the skin that is removed during the procedure. The yellow area represents the skin that is undermined. The final scar will look like an inverted W scar. The majority of the scar will be hidden underneath the breast. Unfortunately, the mid portion will be exposed depending on the size of your breast. My preferred way of doing a tummy tuck is under general anesthesia. The duration of the procedure is between 2 to 3 hours. This is how a tummy tuck is done. The day of surgery will mark the areas with the excess skin. The incision will extend between 20 to 40 inches, depending on the excess tissue and the redundancy on the sides. Then, the belly button will be detached from the rest of the skin and left in place, as shown here. If your muscles are separated, we will bring them together with a permanent stitch. I will pull down the skin and determine the excess. Usually, I'm able to remove the skin immediately above the belly button. Finally, I will make an opening and allow the belly button to resurface into a new skin. we will reinforce the abdominal muscle with a permanent stitch. This will help us decrease the girth of your abdomen. However, it is limited by the gut fat. Please lose as much weight before surgery so we can tighten better your muscles. You should avoid this part of the procedure if you are considering pregnancy in the future. At the end of the procedure, the sutures will look like a pie crust. It will look like bunching and dimpling as shown here. The purpose is to remove the tension of the sutures at the healing point. This will favor a fine line scar as shown in the next slide. Please do not freak out. In this picture, you have the same patient 1 year after her surgery. Now let's talk about risks and complications. The purpose of this section is to inform you, not to scare you. The more that you know, the most likely the operation will succeed. I have always believed that knowledge is power to my patients. Let's start by recognizing that the more tissue that we need to remove, the most likely we will run into complications. However, I will be at your side the whole time to have you sailing through any problem we run into. Poor scars. Unfortunately, the scarring process is unpredictable. As you know, I cut and got heals, or your body heals. You may need future revision when healed from the current surgery, usually within a year after your surgery. You might encounter also asymmetries. You will have numbness of the lower abdomen. This is secondary to the lifting of the tissues and cutting of some of the nerves. It will improve over time. It may recover between 6 months and a year. In some cases, it might not recover fully. Delay healing. It is secondary to the death of the skin or skin necrosis. It happens because of the high tension of this surgery and the decreased blood flow to certain areas, as shown here. It is also more frequent in smokers. Please do not smoke 1 month prior and 1 month after your procedure. Wound separation is more frequent in the areas with major tension or stress. It happens also more frequently in smokers. The management is with dressing changes. You may need further surgery in the future, but you need to wait at least 1 year to let the tissues heal. Dog ears is the redundancy of tissue at the corners of the scar. Some techniques for this prevention are having a longer scar and liposuction of the area. If present, you may need to wait 1 year because of the detachment of the tissues. We can excise it under local anesthesia. We usually do liposuction on the love handles to improve the contour of the flanks. However, the skin is unlikely to shrink and is likely to be redundant in the back. We can always address it in the future by cutting the excess skin. Your belly button may be off-center after this procedure. I will try to do my best to put it in the middle. They did a study in which they demonstrated that only 1.7% of the population have the belly button in the middle. Off-center is normal. Belly button skin injury. The skin can be damaged because 4 of the 5 sources of blood supply to the area are going to be damaged with this surgery. It is more frequent if the umbilical hernia repair is done during this procedure. If present, we will do dressing changes. In some cases, the belly button may have chronic pain. This is especially true with repairing an umbilical hernia. Many patients referring having a pulling sensation. The pubic hairline and genital area shape may change. This is secondary to the abdominal tension pull. Seromas happens between 20 to 40% of the patients. It's the fluid collection between the lifted tissues. We'll manage it with drains. Usually they are removed when they drain less than 30 cc a day, 3 days in a row. We'll use also garments to try to compress the tissues against the deeper layers. We'll ask you to limit exercise, which increases the production of fluid. Skin discoloration is a must with this surgery. It is a consequence of bruising or accumulation of blood within the tissues, giving this black and blue coloring. It is also a consequence of skin burns at the entrance point of the surgery. Skin sensitivity may be present as itchiness, tenderness, or hot and cold sensitivity. Finally, some patients may react to the suture material. This will appear as persistent redness at the incision site. Some patients might form little abscesses. If present, we will need to remove the sutures and do dressing changes. Some other people might spit out the suture. If that is the case, we will trim out it in the office. Tissue swelling is the accumulation of fluid within the tissue secondary to a trauma. Expect a weight gain of 5 to 10 pounds. Usually it's worse within the first 2 weeks. It can last up to 6 months. You will notice that it's better in the morning and worse at the end of the day. You have to be patient. Bleeding occurs in less than 1% of the cases. It will appear as significant bruising and pain at the surgical area. If present, we will need to go back to the OR to evacuate the collected blood and to take care of the cause of the bleeding. There is a risk that we might need to transfuse some blood. It is very important that you do not use blood thinners that may favor this condition. Please review the list of prohibited medications included in your preoperative package. Infection may happen in less than 1% of the patients. We will use antibiotics before and after your surgery to try to prevent it. If present, we may need to go to a hospital for further IV antibiotics and potential surgery. In rare cases, there might be damage to the organs, including nerves, blood vessels, muscles, and internal organs. Deep venous thrombosis is the presence of clots in the legs that might travel to your lungs. The day of your consultation, I will be evaluating your risk factors for developing this condition. If your risk is high, we might need to give you a blood thinner to prevent this condition. Independently if you are at high or low risk, walking is your best friend after surgery. Please start walking the same day after your procedure. Finally, unsatisfactory result. Unfortunately, I cannot guarantee an outcome considering that I have no control over all the variables. Here you will find a list of all the complications that we have discussed so far in the presentation. I will do my best to avoid these potential complications. Most importantly, I will be always to your side, trying to correct any potential issues that may happen. Now, let's discuss some events around your surgery. 2 days before your surgery, we will encourage you to start preparation of your skin using an antibacterial soap called chlorhexidine. I will also encourage you to start a full liquid diet. This will decrease the bowel contents and it will favor the surgical outcome. The addition of milk of magnesia will help cleanse your intestine. Do it gently to prevent massive diarrhea. It is very important that you remain well hydrated. The day before your surgery, you need to stop eating or drinking after midnight. I will encourage you to take Tylenol, 650 mg every 6 hours, starting the day before your surgery. At the day of your surgery, at 4 o'clock in the morning, with a small sip of water, you're going to take your usual medications. You will also take Tylenol 650 mg pill. I will ask you to hold your diabetes medication. After surgery, the dressings that we'll use are an ACE wrap or a binder, depending on the area of the surgery. We'll encourage you to use garments within the first week after the surgery. We'll use drains if there is major mobilization of tissue, or if there is increased bleeding during your surgery. The usual duration of these drains is between 2 to 4 weeks. Pain-wise, most of the patients have a moderate level of pain. Usually they describe it as a working out pain or burning pain. The score is between 5 to 7 over 10. However, it is well controlled with the pain medications by mouth. We'll give you the specific regimen the day of your surgery. We'll use multiple medications for the control of your pain. We'll use Tylenol at 9, at 3, at 9, and at 3. We'll use ibuprofen at 6, at 12, at 6, and at 12. We'll use oxycodone every 6 hours and Valium if we work with your muscles. After your surgery, you will have nausea secondary to the medications used for your anesthesia. We'll encourage you to eat light food, and you can work your way up as you feel better. You will go home the same day after your surgery. We will encourage you to walk to prevent clots that can travel to the lungs. This is how you will follow up after your surgery. In the first week, you will have your first follow-up. Then you will be followed weekly until your drains are removed. A regular follow-up will happen at 6 weeks, 6 months, and a year. However, we'll encourage you to contact us if you have any questions at any time. Now let's discuss some frequent asked questions related to this procedure. The time of work is between 1 to 3 weeks, depending on your job description. You will feel 80% normal by 6 weeks. After your surgery, you are encouraged to walk to try to prevent clots in your legs. Please do not lift heavy. In the first 3 weeks, you need to lift less than 5 pounds. Between 3 to 6 weeks, up to 10 pounds. You might get back to normal after 6 weeks. You can shower 1 week after your surgery. However, you are encouraged to do sponge bathing until that. How to avoid infections. Do not use a cloth on your wounds. These might carry some bacteria that might affect your healing. We'll encourage you to use antibacterial gel soap as shown here. If you have drains, we'll encourage you to use peroxide to the entrance point of the drain to try to kill bacteria. Finally, when you dry up, use a dry, clean cloth to avoid contamination. When can I drive again? When you are off narcotics. If not, you will be considered DUI. Usually it takes between 1 to 2 weeks, but it varies by procedure. Now, let's review some patients that have undergone this procedure. This patient underwent an extended tummy tuck. Appreciate the improvement of the contours of the abdomen. This is the same patient from the side. This patient underwent an extended tummy tuck. Please appreciate the improvement of the contours of her abdomen. Also appreciate the improvement of the tone of her abdomen. This patient underwent a combination of a Brazilian butt lift and a tummy tuck. Appreciate the improvement of the contours of her buttock area. This patient underwent a Brazilian butt lift in combination with an extended tummy tuck. Appreciate the improvement of the contours of her gluteal area. This patient underwent a Brazilian butt lift in combination with an extended tummy tuck. Appreciate the improvement of the contours of her gluteal area. This patient underwent an extended tummy tuck. Appreciate the improvement of the positioning of the stretch marks. This patient underwent an extended tummy tuck. Appreciate the improvement of the contour and tone of her abdomen. This patient underwent an extended tummy tuck. Appreciate the improvement of the contours of her abdomen. This patient underwent an extended tummy tuck. Appreciate the improvement of the contours of her abdomen. This patient underwent an extended tummy tuck. Appreciate the improvement of the contours of her abdomen. I hope that this video was informative and that helped you understand better the details related to your procedure. If you have any further questions, please do not hesitate to contact us. I'm looking forward to participate on your transformation. Thank you again for considering us for your surgery.